Good morning, my friends. It is Dr. Darla, and today I want to talk a little bit about regenerative medicine. So, if you've been around my page for very long, you know that regenerative medicine is a medicine that I specialize in. You've probably seen the term, it's as part of our logo. You may have heard me use the term regenerative medicine in videos. So, I want to talk a little bit about what regenerative medicine is and maybe a little bit about what it's not. So regenerative medicine, that actual term is it's a classification of injection techniques generally used in musculoskeletal sports injuries, orthopedic, joint, ligament, tendon, sometimes muscle type of issues. And regenerative medicine really is about a group of techniques or procedures, treatments, if you will, that will help to regrow and regenerate tissue. So sometimes we will see people using regenerative medicine in terms of anti-aging medicine. In my opinion, that is a little bit different. But when I'm using regenerative medicine, I'm speaking specifically about the orthopedic repair non-surgically of joint pain, joint injuries, musculoskeletal things that happen to us throughout our lives, whether we're an athlete or we're not. So there's several different types of treatments that can be done that fall under that umbrella of regenerative medicine. There's prolotherapy, there's platelet-rich plasma, there are exosomes, there are birth tissue biologics, and there are stem cells. And each of these have a little bit different propensity of what type of application is best for them. Like, are they better for tendons or ligaments? Are they better for cartilage repair? Are they better for muscle? Are they better for joint? And there's some pros and cons to each of them, which is something that you really should talk about with your doctor. Or what are those pros and cons and why we would want to use one treatment over a different treatment. Now, the injection itself, the technique of getting that solution into the body is pretty much the same, independent of what is being injected. And oh, let me reach up here. So I don't even know if this is mirrored on, if you guys can read it, but I wrote a book a couple 3 years ago. It was published about regenerative medicine, and I discussed some of the techniques in this book about what they can be used for, what they are best used for, because that's different. You can use something to treat an injury, but it might not be the best treatment for treating that particular injury. The thing that I think causes the most confusion, and if you're really interested in knowing more specifics about that, you can either pick up the book on our website or you can, ask a question. I'll be happy to do a video about it. But one of the things that I think is the biggest source of confusion right now is the term stem cells. So people will sometimes call the office and say, oh, I had stem cells done with my other doctor, or I would like to get stem cells done. And we need to really understand what it is that is being asked or what treatment was actually being provided. There are what we call birth tissue biologics, and those birth tissue biologics are oftentimes touted as stem cells. And they are not actual stem cells. So the process of harvesting the products out of the birth tissues, and when I say birth tissues, I'm talking about like amniotic fluid or placental tissue, perhaps umbilical cord, either blood or cells. Those cells have to go through a pretty extensive process. They are cryo-frozen, they are flash thawed, and then they are injected. There is no way for those cells to remain as viable cells, live cells. And so when it's coming out of a vial, it's actually not a live cell. So using the term stem cell is technically inaccurate. They are not stem cells. There are procedures that extract cells out of the body, bone marrow aspirations, fat tissue aspirations, that are then processed where we can get what's called a stromal vascular fraction, and those are injected back in, and those are what has really – traditionally been known as stem cell procedures. there is some technical differentiation between those as well. But if you are getting it out of your body and putting it back into it, then we have some live tissue activity in that particular procedure. But we do not have live tissue activity when it comes out of a vial. And so that's a real source of confusion, I think, for consumers, because they want the gold standard treatment of stem cells and all the benefits that come along with that. But they're being sometimes misled that they're getting stem cells out of a vial. So I just kind of want to, do a little bit of clearing up on that. If it's coming out of a vial, it is not a stem cell. It may be effective. It may be very beneficial for the treatment and what is being treated, but just know that it's not particularly stem cells. Just like platelet-rich plasma, or PRP, it is a treatment that is very successful in a lot of orthopedic conditions, but it is not stem cells. Now, sometimes people will ask for PRP and they will call it stem cells because they know that there is some stem cell activity that is kicked up by introducing PRP into that injured area, but it's not an actual stem cell. We are not injecting live cells into the body. We are not transplanting them from one person to another. That's another common misnomer in the US, is that we can take cells from another body and we can put it into your body, stem cells, and we can do that. There are other countries where the laws are different, but in this country, what is known as a stem cell procedure can only come from the donor. So you, as the person, extracted and then injected back into your body, and it's called an allographic procedure, meaning from you back into you. PRP is also an allographic procedure, from your body back into your body. So there are no third parties being involved in those particular procedures. If we're using things like exosomes or birth tissue, amniotic allograft, etc., then there's a third party that has been involved in that. And I don't want to go into a whole, that's a complete video all on its own. But just remember that when you are talking to your doctor and you're exploring what your regenerative options are to repair your injury, really be clear on what it is that you're getting, where it's coming from, what the source is, and what the expectation of that procedure would be in that particular injury, and why it would be expected to really be beneficial over maybe one of the other procedures as well. So hope that is helpful for you today. I tried not to get too in the weeds with the technicalities of things because it's a really short video, but maybe not as short as I would have liked it to. I don't know, where are we? We're less than 10 minutes, but still longer than I intended. Anyway, ask questions, know what your source is, understand the difference between live cells and cells coming from a vial, and really what the best treatment is for your particular injury. I will see you guys soon. Hope you're having a great day, and let me know if you have any questions. Drop them down below. I'll be happy to answer them. Until next time, we'll see you later. Bye-bye.